I have many symptoms, and there are more days than not that I feel bad. When should I ask my doctor about changing my heart treatment plan or medication dose? What tests or lab work are used to measure an increase of my PAH?
Well, the first thing I want to say is that for those of you that feel you have more bad days than good, I'm so sorry. I know how taxing that can be just in terms of everyday life. And it's important that not only are we thinking about, what might be able to be changed from a treatment plan or a medication plan or dose, but who do you have to support you during those bad days and those times that you don't feel capable of caring for yourself. And this is a network that I think is tremendously important. And so I would first say, make sure to connect within your community or within the, sort of national community when it comes to PAH. There are so many support groups, but there are also means to be able to connect with others through the Pulmonary Hypertension Association. And so I just, my heart goes out to you because I think that all of us have bad days. And for those that have a disease such as PAH, that those days are even more of a toll. And I would say that if you feel that you continue to have not just more bad days than good, but that there are bad days, and that you are limited in what you're able to do and accomplish through your day, that those would be the times to have a conversation with your physician about, are there opportunities to improve how I'm doing? What do my tests show you? Does it indicate that I am on all of the right medications, or are there other therapies? Are there other opportunities to feel better and do more and have the good days that will improve my quality of life? And so for me, every appointment with my patient is an opportunity to have those conversations. I think that even when you're having all good days, we want to continue you having all good days. And so in those situations, it would be, how do we continue that? And what therapies are you on? And what does your data show us? And then the second part of that question was what tests or lab work are used to measure an increase of my PAH? And this is a really tremendous question, because I think that often we're asked to do so many things, or I should say my patients to do so many things. Go and get an echocardiogram. Please go do a 6-minute walk test. Can you go to the lab and get lab work? Maybe you need new breathing tests. And those in and of themselves are exhausting. But those tests are so meaningful to us because we're looking at that information and being able to assess, is this pulmonary hypertension that is progressing or changing or worsening or improving? And if it is indicating that there is worsening of pH or increasing of your pressures, then that would help us to move toward discussion of treatment plan changes. So just to say once again, the tests that we often look at that are part of the risk assessment in terms of our patients and their prognosis long-term would be things such as an echocardiogram, a 6-minute walk test, lab work that includes things like an NT-proBNP or BNP, which looks for strain on the right ventricle or the heart. And those are just to name a few. We have other ways of looking into how our patient may be doing or what their body or tests may be telling us. So those are all things that you should feel more than able to be asking of your provider, and that your provider should be feeling comfortable giving you that information and those responses so that you can walk away feeling that you are educated about yourself and your disease.